You're listening to Season 3 of That's Not How a Baby Sleeps. I'm your host, Alicia Daishon, and I'm joined by my co-host, Eleni Katsinis. We're not your average sleep consultants, no cry it out or sleep training at all for that matter.
Ashley, can you please share more about your background and what led you to become a pelvic floor therapist?
Yeah. So my name is Ashley Schaab. I went to DUville University, and I am a doctor of physical therapy. Shortly after I graduated from DUville, I became certified in women's health, pelvic health now. They have changed the name because males and females both have pelvic floors. And I knew I wanted to do something different. I wanted to work with individuals a little bit more intimately, more one-on-one, and this is definitely a one-on-one profession that I get to work in. Through my own journey of pelvic health, reproductive health, and then just having gone through conception and pregnancy and delivering a baby, my eyes have just been opened even more than they were now having that lived experience behind me as well.
Awesome. And you have a daughter. How old is she?
I do. She just turned 8 months on Saturday. It's crazy.
It goes by really fast.
Yes.
Okay, so what exactly is the pelvic floor and why is it important?
So the pelvic floor is a group of muscles that sit in your pelvic bones. So you have two sides of your pelvic bones that come together, and then you have essentially kind of a bowl of muscles, and it's a group of muscles. It's not one muscle, it's a group of them, and they support reproductive function, urinary function, bowel function, and then they have a very close relationship with the core and the diaphragm for breathing, and it does also provide support for the lower extremity. So it is truly central in our body because it supports so much above and so much below. I think when people hear about pelvic floor, they think either pregnancy or postpartum, or maybe someone who's a little bit older who's leaking, but it does play such a dynamic part in so many activities that we do throughout the day that we don't always understand how important proper functioning is of the pelvic floor.
Yeah, interesting. I can't wait to learn more about this because I feel like I don't know enough about my pelvic floor, and I know
I could talk a lot about it. So I will try to keep myself reeled in, but it's just, it's so important. There's so much that we as society don't talk about. There's a lot of taboo topics. So I feel lucky that I get to have these conversations with people and make it more comfortable.
So what are the biggest misconceptions people have about the pelvic floor?
Some of the biggest conceptions, I think I kind of led with this, that only females have pelvic floors. That's not true. Men have pelvic floors as well, and they can also experience pelvic floor dysfunction. They also tend to seek out treatment a little bit later on because it is a little bit more taboo as well, but they do have as much dysfunction as women do. It is not normal to leak. I think that's a very common misconception, especially after having a baby, that, oh, well, you had a baby, so you're just going to leak now. That's not normal. So that's, something that I think is misconceived about pelvic floor. Then the other big thing would be that painful periods are normal. I think that a lot of us grew up with that narrative that, oh, well, it's just a part of having a period and being a woman. And that's not true. Our period can give us so much information about our overall health. And when it's painful or uncomfortable or a lot of symptoms that we would normally report, it can get a lot of information as to what might be going on in the body.
That's really interesting. I've always been pretty fortunate. Like, I've never really struggled with cramps or anything like that, but I didn't know that was like not a normal thing.
Yeah. And, we can kind of classify, some cramping is normal, but debilitating cramping for more than a day can indicate dysfunction, either like a hormonal imbalance or some sort of underlying condition. And I think the treatment course of that for a very long time, and probably still is putting people on birth control. And that's not identifying the root cause of what's really going on. I'm going to go off on a little tangent here, but individuals get put on birth control for 5, 10, 15 years. I was on it for a decade. And when we come off of it, I think we're very fearful, to come off of it because we're afraid of what our cycles are going to be like, especially if there was maybe a reason that someone went on it in the first place to manage a period symptom like painful periods or acne, whatever. But sometimes just as we age and mature, our hormones age and mature. Sometimes it's not as bad as we think. But if there was a reason that people were put on it in the first place to treat a period problem, I'll say, sometimes that can still be there because it was never addressed. It was unfortunately just covered up.
That makes a lot of sense. I hear that all the time. And like as Alicia said, I'm pretty fortunate with not having horrible periods, but maybe I have everything going on the way it should, which really,
Yeah, I'm like, oh, I feel really confident now.
which is nice to hear. I'm like, whoa, my pelvic floor. But also I wanted to ask about, I know you said leakage, like it's normal. It's not normal to leak. And I know that. Do you mean leakage as in like excessive discharge or urine or both? Or like, what are we leaking out?
I was specifically talking about urine, but I would say discharge, depending on the time of the month, probably isn't normal too. That can be indicative of something going on hormonally, especially like right before your cycle. If you're getting either spotting or discharge, sometimes that can mean something else is going on. But I was specifically talking about urine.
Okay. Because I know me and Alicia talked about that we both pee our pants, which is I know is not okay. I know I should probably go see it.
Whenever you want to make an appointment or have a chat, you know that I'm here.
I'm a specialist, but I didn't do the exercises consistently and stuff. Like, yeah, it's just a me thing, not being consistent with stuff.
It's tricky, especially if it is something that is going on in the postpartum period. And I'm sure we'll kind of talk about this a little bit more, but there's just so much that's going on that we don't allow ourselves the space to always heal, I would say, or we kind of push it off because the baby is our priority. So I like to encourage people to just get in a little bit earlier. Sometimes it does resolve on its own depending on like how birth went, but sometimes we do need to take a little action and give some, specific exercises or look at habits or things that are going on that might be, contributing to the leakage as well. Yes, sometimes you have to be consistent with the exercises, but sometimes it's just a little tweak. So, either way, I think it's beneficial to learn what you may need for your body.
I think pelvic floor is so important, especially for postpartum. That's something that should just be necessary. I feel
yes.
like, and I'm sure
a standard of care.
Yes, which unfortunately it's not, and we know that that's such a gap in our services for women and mothers and postpartum and all that stuff. And I feel like you're forever postpartum, especially when it comes to like your pelvic floor, because I'm 5.5 years postpartum, but I feel like I should still be doing things to strengthen that. And of course, if we have another kid, I want to be stronger before that even happens and during it as well.
Yeah. And I think too, I'm fortunate that I see such a age range of individuals, but I see postpartum individuals now, but then I also see like their mothers because maybe they had something going on after they had them that wasn't addressed because pelvic floor therapy really wasn't as big as it is now. So, sometimes those things that happen earlier on in life, if we don't address them, can be a factor as aging processes happen, but also because of maybe a trauma or an injury or something that happened too.
Yeah, that makes sense. How does pregnancy change the pelvic floor, even if someone had a smooth pregnancy?
So your pelvic floor supports the growing contents of your uterus. There's fluid, there's a baby, things are being stretched, things are being pulled. So the pelvic floor is that, group of muscles, and it has a job to hold everything in until it's ready to come out. So you gain weight, there's different things that are going on. There's a lot of other structures in there that the pelvic floor can be influenced. If pregnancy is smooth and, people don't have any dysfunction like pubic symphysis dysfunction or sacroiliac dysfunction, there's still pressure that's put down on that pelvic floor because of the growing factors in our abdomen. And then after delivery as well, that can affect our pelvic floor regardless of the mode.
Interesting. So I know you mentioned here a little bit about like a C-section. How about in regards of that?
Yeah, those C-section deliveries are no less risk for pelvic floor dysfunction than a vaginal birth. They are different, but I think it's like also common misconception that if you have a C-section that you won't have a pelvic floor issue. And I think when you think about what occurs during a cesarean delivery, we're cutting through so many layers of muscle and fascia and tissue. And then eventually the uterus is taken out of the body and then placed back into the body. And that can affect your pelvic floor because of how intimately those muscles on top of your uterus work with your pelvic floor. So C-section scar mobility and function is really important. When you have a C-section, there is sometimes anesthesia and a catheter involved. That can also affect pelvic floor dysfunction. The biggest thing that I see is like really with C-section scar mobility, but it's not unheard of to hear dysfunction in the pelvic floor also with the things that happen during a cesarean delivery too.
Wow, that makes sense. I just thought about that too, because with an epidural, you get a catheter, right? Because you can't get up to walk around and pee.
Yep.
So I'm sure that's something that, because just like what me and Alicia do, like I'm sure you do the same thing. Like we have a whole intake form for our clients, for the babies to work with before we even like touch sleep. And same with you. You probably want to know like, how was birth? How was pregnancy, right? Like, did you do this, and that? Because I know that you have your own practice, so you're able to have those questions, right? And you're able to talk that through and really get to know your client. You're not just like checking them in and out for 5 minutes, like you're staying with them for a long period of time, right?
Yes. My intake form is, I will say, relatively long, but then when a patient does come in for a first session, we're still talking about that in depth. And it doesn't matter how far, like you said, postpartum is forever. I still want to know how your deliveries went, even if you're 5 or 10 years postpartum, because that stays with you. That experience stays with you. And then on top of that, if there was anything that did affect your pelvic floor or, that area, we want to know those things. It doesn't matter how much time has passed. It can still be a factor.
Totally. Especially if there's like birth trauma there, right? Like if you never recovered from that birth trauma, like mentally or physically, like
yes.
I'm sure, like you said, you see that years later, which I know that you can help with that, which is awesome.
Yeah. And I think now too, having gone through this experience myself, I don't want to say that I was an imposter before, but I have such a better understanding of what individuals go through that are giving birth, but it changes you. And the mental and physical portion of delivery can stick with you for longer periods of time. And if you do want to have another baby, that could be a factor in the back of your mind. And I want to encourage women who are pregnant that are listening to this to come to pelvic floor before you deliver, because I think there's so much that we can talk about. There's so many conversations that we can have about, the goals and preferences that you're hoping to achieve, so that when the time comes and, the show is about to start, you don't feel like you're not able to make the choices that you want to make. That the experience is happening and you're a part of it, not that someone is making the choices for you. Does that make sense?
Yeah, no, totally makes sense. We talk about that all the time. We wish that we can catch pregnant families before we see them, like postpartum. And sometimes it's hard to get that, because when we're pregnant, we're just thinking about like the after, like how do we get this baby out of me? I don't care about what's going to happen after. And they're probably not thinking about their pelvic floor unless they're having like severe symptoms, right, that are causing pain. But when you get to that point, it's probably like, you should have seen me a long time before that, right?
Yeah. And I get it. Trust me. I understand now better than anyone, like your time in postpartum for appointments for yourself is limited.
Yeah.
But if there is one thing that you're going to do for yourself, is just make that appointment, especially if you are having dysfunction, because you don't want to let that fester and grow and then affect your quality of life.
Yeah, totally.
I did see a pelvic floor specialist before I had Luna, my second, when I was pregnant. And I felt like seeing her prior to having Luna was good, because I got myself booked in for those follow-up appointments ahead of time before I had the newborn, and was like, no, I'm not going to take care of myself. So that was really helpful. I liked seeing the pelvic floor specialist before I had a baby.
Yeah. And I had a client yesterday, and she's a first-time mom. She's about to give birth in like a month or so. And I just really enjoyed having those conversations, because sometimes your provider doesn't have that time to talk to you about these things. And I think that the more educated and prepared you can go in for any experience, even sleeping with, your new baby, after just kind of having a framework. I won't say like a set plan, because that doesn't always happen, but the more that you can go in with, the more knowledge that you can go in, the more tools in your tool bag, I think that your experience is a little bit more likely to have a positive outcome.
Yeah, totally. So what can we do then during pregnancy to support our pelvic floor health?
Yeah. So some of the biggest things is if there's any underlying pelvic floor dysfunction that you were experiencing before, I think kind of coming in and getting that taken care of or addressed, because you're just going to have so many other changes that are occurring over those 9-10 months that you're pregnant, making sure that your bowel movements are consistent and going. I know that that's really common, especially in the first trimester, to experience constipation, and then things start to get pushed up. So digestion changes, but just making sure that your bowel movements are regular, because that puts a lot of pressure on your pelvic floor, pregnant or not pregnant if you're not going, but especially during pregnancy. Then addressing any discomfort. I think a lot of individuals feel like, oh, well, I'm pregnant. This is just a part of what I'm supposed to experience. This low back pain, this, lightning crotch, this sacroiliac dysfunction. There are other providers, myself included, that can assist with reducing this discomfort so that this time frame that you're pregnant is not miserable. But yeah, I think addressing some of those things is really important too. And then just the education on how your pelvic floor works. I think it's not until people are having a baby, unless they had like previous pelvic floor dysfunction or issues, that we're really learning about it and what it does and how it works and like that connection with it. Because when you are birthing a baby, or just going through pregnancy, there's so many changes that can affect it down there. So now that we have an idea, we're like, oh, I understand that connection a little bit more now that it's conscious, like brought to the forefront, I guess.
Yeah, no, that makes sense. Can you walk me through like a mini little example of your like work with somebody? Like I know I hear a lot of people talk about pelvic floor, right? They go in and like some people say, oh, it's like internal work or it's external work, right?
Yeah.
You probably do both, I'm assuming, or it depends on your client. I'm sure every single thing's unique, right? So I guess just about like pregnancy, little example of that.
So with pelvic floor therapy, sometimes an internal examination is warranted. It does give us a lot of information. Not everyone is comfortable with that, especially on the first visit. And I completely understand that there's so much that we can learn and gain and educate the individual on just from the conversations. And there's a lot of external things that we can do. So it doesn't always have to be an internal exam. It does provide a lot of information though. So, you have to weigh those things and see what the client is comfortable with. But for an individual who was pregnant and coming in and maybe wanted to learn how to push or kind of learn about, what is birth going to be like and how do I optimize my pelvic floor so I reduce my risk of perineal tearing or things like that. They would come in, we would talk about pelvic health history and their overall health history in general. And then if they felt comfortable, we would at least do an external examination. So kind of having the individual undress, but making sure we can watch their pelvic floor move externally the way that we want it to with some cues. And then we would go over based on their preferences or, the goals that they're hoping to achieve, different laboring positions, different breathing techniques, some birth prep stretching, making sure that we're doing a lot to like open our hips and stay flexible. And then also just activities of daily life, getting in and out of bed, getting on and off the toilet, getting in and out of a car, because as our belly changes, sometimes those things are more difficult and we want to do that the safest way possible, making sure that we're not increasing our risk for diastasis recti, which is that abdominal separation. And I have a lot of clients that stay really active until the very end. So ensuring, or if they have another kid at home, making sure that lifting mechanics are done well, we're breathing, we're not putting more stretch on our pelvic floor or pressure down on our pelvic floor. And then any follow-up sessions is just anything else that we're trying to cater towards their birth experience. I just want people to come in during that time because I think there's just so much that we can talk about. Like I could talk about this all day. It's so important to come in during postpartum. And even if you come in for one visit during pregnancy, to learn and understand what's going to happen or what could happen and how to be in tune with your body. I think that's one of the most beneficial things that you could do. I saw a pelvic floor therapist when I was pregnant, and I am one. Everybody needs one. So I think that that's just something that that's like really my mission now that I've had a baby myself, is trying to get people in before, so that we can start those conversations and get them into the right hands if they have more conversations, whether that's a doula or a chiropractor or a massage therapist or a sleep specialist or a lactation consultant, based on their preferences, how can we set them up for the most success?
Yeah, that's awesome. What does pelvic floor healing look like in the early postpartum weeks, and what is actually normal?
That's tough, right? I think that there's a lot of pressure out there, and especially with social media, that there's, this window like 6 weeks. Doctors clear you at 6 weeks. You're healed at 6 weeks. And that just is not true. I would say that that's the biggest thing that I want to hit home, is that pelvic floor healing after a baby is slow and it's very hard to be patient. I totally understand that now, being on the side, but 6 weeks is not enough to heal. You need to give yourself a lot more time. The biggest things that I would say in those 6 weeks is managing those bowel habits, because that's going to put a lot of pressure down on your pelvic floor. So whether you had a C-section or you had a vaginal birth, sometimes those bowel movements, as we hear, are uncomfortable after. So making sure that you're not getting constipated, you're hydrating, you're doing all those things to keep things moving. Some breathing exercises would be really beneficial just to get that neuromuscular education back to your core and pelvic floor, because things stretch out and there's so much pressure. Now that that space is kind of emptied, we do have to relearn how to activate those muscles, because activation when there is a baby there is different than when there's not a baby there. And what I equate this to is like if you had a shoulder surgery or a knee surgery or something like that, you're going to PT after those procedures, those surgeries, those planned traumas. Birth is no different.
Yeah.
I think that that's just something that we need to give ourselves a little bit more space to accept, that this is not any different than having a knee surgery or a shoulder surgery. Different in different ways, but the recovery should be treated the same. Does that make sense?
Yeah, it makes sense. And like we're expected to go back to work at 6 weeks. And we're expected to be fine with having sex after 6 weeks. I just don't think like that's the time to do those things. Like
No.
you should still be healing and like recovering. And
Yeah.
I know you said something about like when is I guess the right time to visit like you right after birth. I mean, should you wait a little bit and then go?
I like to tell people whatever they're comfortable with, because I know that being fresh postpartum is so different for each person. But if you can come in at 4 to 6 weeks, just so that we can talk about your experience and we can still give you some really gentle things that you can be doing, just so you don't feel like you're doing nothing, but you are doing something that's proactive, and then addressing any potential pelvic floor dysfunction based on the delivery is a good time frame. Usually if I see somebody that early, I'm not seeing them like every week. I'm going to see them once and then give them a little bit of time, see how things are going, and then see them back, a couple weeks later with the things that we talked about, just to make sure that everything is healing well. And in New York State, you don't need a referral to see a physical therapist. You can see a physical therapist with direct access for 30 days without a script. So you can come in, even if your doctor says, you don't really need that. You can still come in and see a physical therapist in New York State without a referral.
Okay, cool. I know you briefly touched on this, but I wanted to talk more about it. I know many parents, especially moms, feel the pressure to like that bounce back culture. So I guess how can we shift that conversation to supporting the body's natural healing process instead?
Yeah, and that's hard. I experience this myself all the time still. But I like to remind people, myself being one of those people, of what their body just did. Their body conceived a child and then carried a child and then birthed a child. Regardless of the mode of birthing, I would not expect anybody, even elite athletes, to feel 100% at 6 weeks. Like that's just crazy. That's insane. So I just like to remind people, I know that you're frustrated, that you don't feel like you can do the things that you want to be doing at this point, but it's not to say that you'll never get back to them. You absolutely will. It just might take a little bit of time. And this is a great time to practice patience and like trusting and loving your body and what it just did and what it's still doing in this postpartum period. I needed this reminder often. I'm 8 months postpartum and there's still stuff that I can't do. And is that frustrating? Because on so many levels, I do feel good and like I could do some of those things. Yes. But I also like to remind myself that when I feel ready to do those things, like I will do them again. But just reminding people that there's nothing wrong with not getting back to your, pre-pregnancy activities right away. It took 9-10 months for this pregnancy and delivery to happen. It may take 9-10-12-16 months for that full recovery to happen too.
Yeah, I think that's great. And just allowing yourself, like you said, to do that, because we have such a bounce back culture. And like you said, social media is not real. A lot of things on social media is not real. You might look physically okay on the outside, but that mom could be like screaming in pain inside. Actually not okay. So just like trying to not think about that and just recover like mentally and physically, especially.
Yeah. And I would say now, having gone through this experience myself, like my experience is not going to be your experience, is going to be your experience, right? Like everyone's situation of their own healing, of their own postpartum, how their children are, like it's individual. So it's so hard to not compare, especially when we see these people doing things and you want to be at that point. But I think the biggest reminder is that your journey is your own. It's unique, and it's not going to be that person's journey that you're seeing on social media. And that's okay.
Yep. Just like our children and their sleep habits, everything's unique and everyone's
Yeah.
their own ways, just like our pelvic floor.
Yes.
unique and
Yes.
So what are the most common postpartum pelvic floor issues you might see? I know we touched on this a little bit, and how treatable are they?
Yeah. So some of the most common postpartum symptoms or issues that I see, definitely pain, especially pain with intercourse or insertion. So if someone does get their cycle back, sometimes inserting a tampon or a cup or a disc can be really painful, but definitely intimacy, feeling weak in their core and pelvic floor. Hemorrhoids are a really big one. Sometimes we can't necessarily avoid those just because of like the pressure that's down on the pelvic floor and then sometimes pushing, but learning how to manage those, managing our bowel habits and toileting mechanics, making sure that we're not straining or pushing and making sure that our bowel consistency is good. Those would be the big ones. Pain's probably the biggest one that I see. And then diastasis recti, that abdominal separation, is another one. And it's a very common thing. And there's a statistic that says like 60 to 95% of individuals have a diastasis in their third trimester. So it's not uncommon, but we just want to make sure it's not interfering or potentially adding to a pelvic floor issue because there's weakness in that abdominal wall.
Is that something that you can heal without like surgery?
Yes. Yeah.
Okay.
So that stat is what it is because it is very common. The biggest things that I like to remind my patients with diastasis is that the tissue is stretched. There's not a hole there. It's just there could be a lot of tissue laxity or a little bit of tissue laxity. And the biggest thing that we're looking for is how well do you engage your core? So it's not necessarily at one point, there's a lot of talk about let's close the gap. Let's bring let's bring those rectus muscles back together. Sometimes that happens and sometimes that doesn't. But the biggest thing is, are you engaging your core well in relationship and in synchronicity to your pelvic floor? And if you are not, is that leading to other things, pelvic floor dysfunction, low back pain, hip pain, urinary incontinence, etc.? Because all of those things can be related to that abdominal separation, especially if someone is trying to get back into activity. But even if they're not, it can still play a factor. I think I could say this. I don't think I've ever had someone that went to have surgery, not necessarily because we did something amazing and closed the gap, but I think it's just recognizing that sometimes that tissue may stay stretched, but it's just how well are you managing, engaging your core and pressure in your abdominal area.
But it's not a hole.
No, it's not.
I wasn't told that, but social media and stuff.
Yeah. So you have your six-pack muscles, your rectus abdominis. There is fascia, which is like it cases the muscles and then it kind of brings them together. It has a little bit of like a tendinous structure to it as well. But what happens is it just stretches and stretches and stretches to accommodate for that baby being in there. And then it kind of shrinks back. So if you think about it, it may be a poor example, but like when you sprain your ankle. When you sprain your ankle, those tissues get stretched out, that it's almost like a rubber band getting stretched out. And sometimes with activity and muscle activation, proper muscle activation, we can retract the stretch of that tissue.
Okay. And that's something that you work on with clients if needed, right? Mm-hmm. And how long of a recovery does that usually take? I mean, I'm assuming that it depends on the client, right? How severe, how mild it is.
Sure. And like how many pregnancies have they had and like how active were they? It's very dependent, and I don't want to like put a time frame on that just for.
And there's things you can do to prevent it, obviously, like everything that you talked about, or no? I mean, it can happen, right? Even if you have a smooth pregnancy, a smooth delivery, it can still happen.
Even if you're engaging your core and, working on your core during pregnancy, which is safe to do. Certain positions will be modified as your belly grows. You can still work on core engagement. That is also something that I work on during pregnancy with people, is just that proper core engagement. But some of it is inevitable. Just because your belly is growing and your tissue is stretching, that's not something that we can stop. But there are things that you can do to probably minimize and mitigate the level of that by engaging your core well. If you are still participating in any sort of like exercise, like weight training or aerobic activity, making sure that we're lifting properly, good breathing strategies, good toileting strategies. So unfortunately, it is a little bit inevitable.
Yeah, I get it.
A lot of people think kegels are like the only thing the pelvic floor therapy is, and that's not what it is. So just maybe breaking that stigma of like, okay, you may look something up on the internet and kegels are there, but kegels aren't appropriate for everybody.
Okay, that makes sense. Because I feel like when everybody talks about pelvic floor, they're like, oh yeah, I'm fine. I do my kegels.
Yes. And not everyone needs strengthening, especially sometimes like individuals that have pain or discomfort. Yes, we may need to strengthen at some point, but what we need to do is get the tissue back to like a safe state first. So sometimes when we have pain or discomfort, our tissue likes to like protect the area that's causing pain or discomfort. So if we're in a protective state and then we're also doing some strengthening exercises, our body doesn't know how to get back down to like that baseline level. So Kegels are great when they're appropriate, which is why I think it's beneficial to be examined by a provider, because that might not be the best thing for you.
Yeah, that makes sense. So how can someone distinguish between like normal postpartum symptoms and one that needs like actual professional support through it?
Yeah, so that is definitely tricky because there are some things that can happen that I wouldn't say are normal postpartum, but that may improve just with time. Your body goes through so much during that delivery that some of the pain and soreness and discomfort is our body telling us to take a break, slow down, something happened there. So I think it's a positive thing, but when it's lingering or interfering with activities of daily living, especially like caring for your child, I think that that's important to come in. And I just recommend it, just like after any surgery or procedure, like come be evaluated. If nothing else, let's talk about the delivery. Let's talk about what to look for. So even if you're not experiencing anything at this point in time, down the road, hey, I think that pelvic floor therapist mentioned something like, if I'm still having pain with sex at this point in time, I should maybe, get checked out again. Yeah. So just having those open conversations about what to look for to be proactive, I guess.
Yeah. Okay. Because I feel like we talked about before, postpartum is such an interesting world, right? Like you go to your OB and like they don't even do an internal at the 6 week to 8 week, right? Like, and I actually asked for one because I felt like things were funny down there. I just like felt like something was off. And I was like, can you please just check me to make sure I'm okay? And honestly, I don't remember what was wrong, but there was something going on down there that they had to like do something. I don't want to get too vulgar into detail, but I'm like, if I never said this, like this could have led into something a lot worse. And when we were ready to like have sex, it would have freaking really hurt me. Like I swear it would have. So I'm like, this is not a standard care in like your OB's office. Obviously, they're not like, they don't care about us.
No, after you have the baby, they're just focused. The baby's good. You're good. Yeah. Okay, cool.
Like, resume all activities as you were before.
It was just crazy because I went in for my 6 week and they're like, well, baby's good. Like, how are you doing? I'm like, I'm okay, I think. And they're like, okay. I'm like, nobody's going to check down there? Like,
I'm not looking down there. So it's your job to look down there.
Like, I can't see down there.
Yeah. No, I think that it's so important to advocate for yourself in those situations. And like, if you feel like something is off and your provider is not paying attention to that, great step into pelvic floor therapy too, because we can definitely take a look at those things. And then like, I don't know, consider your provider. I think that your provider should be listening to you. And I talk about this a lot. I know that these providers do this every day. So maybe for them, it's another person, it's another postpartum, but it's your individual experience. It could be your first time going through this. So I hope that they can understand that treating people like it's their first time all the time is how they're going into those situations. Just because, you just don't know. And you advocated for yourself, thankfully. But what happened if you didn't? What if you had an infection? What if you had sutures that weren't healing well? What if, you had like a stitch that got infected from your C-section delivery? Like, I've heard it more often than not. People are like, oh, it's fine, you're fine. And then there was something that was wrong. And your mom intuition is kicking in. Something is not right in my body. Yep. That's why I'm bringing this up.
Totally. Yep. So what are some small doable daily habits that moms can support their pelvic floor without feeling they're adding just one more thing to their massive to-do list or one more appointment and such?
I would say the biggest things in postpartum outside of like resting would be staying hydrated, managing your bowel movements, and then doing some really controlled breathing. That's going to work in synchronicity with your pelvic floor. That's something that I like to go over in like my last visit with a pregnant patient. There's something that they can start just to reconnect them with their body because so much has changed. But habits to decrease pressure.
Yeah. Awesome.
Yeah. The biggest thing that I can say, especially working in pelvic floor PT, like not everybody needs biofeedback. It's not functional. And that's where you kind of get hooked up to a machine and they're having you kind of like contract and relax and you're getting, real-time biometric data about what's going on in your pelvic floor. It can be a helpful tool, but if that's the only thing that you're doing, we're not achieving functional goals. Like if your goal is to get back to running or pick up your kid without pain or have sex, that's not going to be the thing that's going to fix it. And and this is general for physical therapy, if you're working with someone and they're doing the same thing with every single person, they're not individualizing and catering to your goals. And I think that that's a disservice to the patients.
It's the same with sleep.
Yeah.
Yeah.
Honestly, my experience there, I still was able to do a lot of the things that I wanted to do. I had a lot of flexibility there in terms of how I wanted to treat, but you still have unfortunately the confines of insurance. And I've worked in many places with many different physical therapists on clinicals and through different jobs that I've seen people just get put through the same routine all the time. And like, that's not okay. Yeah, it's not okay. It's not helpful. The patient is going to be there so much longer because you're not actually focused on what they're trying to achieve. You're just giving a bunch of exercises. It's very frustrating because I've seen it and I see it a lot in orthopedics more than anything. But yeah, it's sad.
I have a question. And it's because I've probably seen it on social media, but the whole like the mom pouch situation.
Yeah.
Is that a pelvic floor issue or
what do you mean mom pouch? Like someone has a little
like a C-section shelf or like
can't lose that like little bit of weight in your lower abdominal muscles.
Yeah. So I think it can be a multitude of things, but the biggest thing, and I'm trying to remind myself of this as sometimes I experience that, is that my uterus just expanded a lot to carry my child. So again, unfortunately, like a rubber band analogy, sometimes when things stretch out, they don't always go back to the same size that they were before. So you just have to remember that like things are different in your body now that you've carried and birthed a child. The shelf in relationship to a cesarean delivery can be, and not cesarean, I guess, too, but it can be related to posture, how you're standing, how you're engaging certain muscles or relaxing certain muscles. So that is something that we definitely go over. And then also like scar tissue mobility. So sometimes if there's like tightness at the edges of the scar, that can cause that like rolling over of the skin. So working on that scar tissue mobility is really important to reduce that. That's like one of the biggest things. Like if I have a mom who had a C-section, making sure that we're not like, this posture, right? Where you're like kind of sitting back on the couch with your baby. It's super comfortable, but that's just providing a lot of like crunching in your abdomen, for lack of a better word. So that, unfortunately, as comfortable as that position is, because I was in it a lot, can also play a part on how scar tissue is healing. So, making sure that you're standing up and stretching, and when you feel comfortable to do those stretches, especially after a cesarean delivery, that we're working on lengthening that tissue and then doing scar tissue mobilization, whether that's coming in and getting educated on how to do it and then doing it at home, or coming in for some sessions for some manual work.
Okay.
Thank you.
Yeah.
Is your like scar tissue from a cesarean supposed to hurt? I know it's normal for it to hurt after a little bit. Obviously, you're recovering from a major surgery, but like 18 to 20 months postpartum, should it still be hurting? Or like at times, like does it hurt? Is that normal, or should that not be happening at all?
I would like to say that that's not
okay.
What I would like to see in a client at 18 to 24 months.
That's what I thought, because I have someone that I know that is like 21 months postpartum, and she says that at times the scar is still in pain or bothering her. And I'm like, that doesn't seem right.
Yeah. And again, there's a lot of factors probably that are playing into that. Did she have like a stitch that got infected or anything like that after? But at that point in time, I would really hope that someone's not having pain with their scar still.
Is that something that they can come see you for, or would you recommend somebody else? Yeah.
Yeah. And I think that it's really important to start early. We can talk about those positions. Sometimes getting like silicone scar tape can be really beneficial early on too, because that can help with like scar maturation. But it also just depends on routine healing. I remember I had a client and she had a persistent stitch that would get abscessed and infected. This was her second delivery. Her first was, she had some trouble with the C-section scar, but her second one had this like abscess, and the doctor's like, I don't see anything. She went in, had it drained, it popped a couple of times. That's going to definitely impair routine healing in terms of time frame, because it's not.
Yeah. Okay. I need to tell this person to come see you.
I'm ready for them.
I know. I refer everybody to you anyways.
Thank you.
So what is one thing you wish every new parent knew about their, I know a lot of things.
This was a really tough question. It really was. And I think I have to, again, remind myself of this, and this is as a person and for your pelvic floor. You are not the same as you were before this experience, this journey that you went through. Your pelvic floor and the anatomy down there is different. And that doesn't mean that you won't feel the way that you did before. But I just want to remind people that things have changed. That's not to scare anyone to say that you're not going to feel the way that you were before. You're not going to be able to do the things that you were before. You will. It just may take time.
Yeah, that's great.
That's the biggest one. I'm sure I could say a lot of other things, but that would be the biggest thing. And I remind myself of that probably once a week too.
Good. That's good. Take your own advice. I'm so glad.
Yeah, I'm getting better at that.
Where could listeners who are not in Buffalo connect with you and learn more?
Yeah. So I am on Instagram at la pelvis, _la _pelvis. My website is in the bio if anyone has any questions or anything like that. And then I work out of the Lighthouse Birth and Yoga Collective, which is in Cheektowaga, New York.
Awesome. And even if you're not local, you post really great Instagram videos just about like little workouts, or you talk about stuff, and you have a lot of great education on there. So you can always follow her and see what's going on with your pelvic floor.
Thank you. I appreciate that. Social media is not easy, but I feel like there's a lot of people that can be reached with that modality.
Yeah. Awesome. Well, thank you so much for coming.
Thank you guys. This was so much fun.
Thanks for joining us. Don't forget to connect with us beyond the podcast. You can find me on all social media platforms at moonbay.sleep. And for more sleepy goodness, you can head over to Instagram and follow Eleni at Rooted in Sleep. Until next week, keep embracing the chaos.